Welcome to our Medicare for Beginners program today. I am Linda Havens, one of the social service case managers here at the Licking County Aging Program. And later you're also then going to meet Samantha Fitz, who goes by Sam, who is also going to present part of our presentation today. So let's get started. I do want to tell you that we are practicing social distancing. And the reason I'm not wearing my mask during the presentation is we do have clients that do read lips. This way they will also be able to hear the program through reading our lips as to what we're saying. All right, let's talk about our goals today. Some of the things we'd like to accomplish. Our goals are that when you are done today, you will have an increased knowledge of Medicare. Medicare is a little bit more complex these days, so we want to make sure that you at least understand the basics of the coverage in that you are going to have now under Medicare. We want you to understand the options you have. There are options now that you have to decide, and those first options can be very important as you head down the Medicare path in your life. Lastly, we want you to be able to make informed decisions so that you have the knowledge so that you can make the decisions that are best for you. What is Medicare? Medicare is a federal health insurance program that was started in 1965. Initially, it was established for people once they reached the age of 65. Now, it's been changed and updated so that people who are disabled for 2 years then automatically go on Medicare. Now that's disabled through the Social Security system, like I said, and then they're on disability for 2 years and then they're eligible for Medicare. And lastly, if you're diagnosed with end-stage renal disease, you are automatically eligible for Medicare. Okay, this is the new Medicare card. For people that have been on Medicare for many, many years, it was their Social Security number, followed by an A, a B, a C, or D. And what that number told them was, yes, what their Social Security number was, but it also said how they were collecting their benefits. Well, the Social Security Administration and Medicare in that felt that having the Medicare number or the Social Security number out there available to anyone could lead to some kinds of scams or people stealing their numbers. So this year, people then got this new card. So now it has all types of letters and numbers on this. Now, when you go to your physician's office or to the hospital, you do need to show this card, okay? And then it will also say when your Part A and your Part B, when those became effective for you. Part A coverage is basically that of hospital coverage. And inpatient hospitalization, skilled nursing facilities, for example, if you've had a stroke or you need rehabilitation after a surgery, then that will cover for skilled nursing facilities. Home health care, so that a nurse in that can come out into the home and visit with you. And lastly, hospice care. So those are covered under A. B is the medical portion of it. This is all your outpatient services, your doctors, any other providers that you may go to. Preventative benefits. There are some things like flu shots and such like that that are also included in Medicare. And lastly, your durable medical equipment. Now, Part D, which was added years ago here, Part D now is prescription coverage. So that is the plans that you take out under Medicare. And then lastly, which Samantha will explain more later, is the Part C, which are your Advantage plans that cover all three. And like I said, Sam will talk about those later in the presentation. Okay, it's time to apply for Medicare. What is it you need to do? All right, if you're already receiving Social Security or railroad retirement benefits, you will automatically be enrolled in Medicare, and you would get your Medicare card automatically in the mail. But for those of you that need to sign up, you have 7 months in which to sign up for Medicare. You have the 3 months prior to your birthday month, and you also have the 3 months after your birthday. Personally, We usually recommend it's best if you can go ahead and sign up the 3 months prior, because sometimes signing up after your birthday can get very complicated. So we usually recommend, like I say, the 3 months before you need to start looking at Medicare and getting signed up. With everything with the pandemic going on right now, a lot of people are calling Social Security and making appointments, and then they will go in and have an appointment. And you can also then apply online. Now, when you're signing up for Medicare, these are the things you're going to be looking at. Basically, you're going to sign up for A, B, and D. Okay, you want your hospital coverage, your medical coverage, and your prescription coverage. Now, when you sign up during this initial period, you will basically sign up for A and B, and the D is going to be a choice that you will make as to what prescription coverage you're going to want. And like I said, Samantha's going to explain that a little bit better. Okay. All right. Now, if you miss your initial enrollment period, and sometimes people do, if you miss it, you can still sign up, but you can't sign up until January, February, or March of the following year. And the problem with this is if for some reason you forget, your coverage is not going to be available till July 1st. So that whole period of time from your initial enrollment down to July 1st, you could be without any type of coverage. So that's, like we say, it's very important you apply in your initial enrollment. Okay. Also, if you have credible coverage under yourself, you're still working, or your spouse, you retired, your spouse is still working. If you have current group employer health insurance, you can actually delay signing up for Part A, Part B, and Part D, but you have to make sure that it is credible coverage. Part A, for most people, costs nothing. So many times people will go ahead and sign up for Part A, but maybe they'll delay their Part B till later when they need that coverage because there is a premium associated, as is also with Part D, which is your drug coverage. Now, it says right here, when you have coverage through your employer and you go ahead and sign up, let's say you pick up A. Okay, while you're under your employer, you're fine. But then once you retire, when you retire, even if you're under your husband's retirement insurance, you have to now then choose your own insurance because retirement insurance is not credible coverage. So, okay, your coverage is going to end. You have 8 months after your coverage ends to pick up A and B. Now, if you want your prescription coverage, which you will, or if you decide to go with an HMO, which, like I said, Samantha will explain, you only have 63 days. Personally, I don't think I'd take 8 months. Usually the best thing you want to do is make sure when your other insurance is ending, your Medicare is starting. So that's usually the best way so that you have continuous flow of benefits. Now, if you are receiving VA benefits, you do have to pick up the Part B at age 65. So for any of you out there that are receiving VA benefits, please remember that. The Part D prescription coverage is considered credible, so you can delay that if you wish to. Okay, the deductibles. These change every year. This year, currently, Part A, for those of you that have enough quarters in that you have worked, you can get Part A free. You don't pay a premium. Now, there are some people out there that never worked or don't have enough quarters in, and they would have to pay a premium, and that premium right now is between $400 and $500 a month. And you're usually billed for those, but the majority of people that go on Medicare, they do not pay for Part A. Your hospital deductible. Each time you go in the hospital, now let me explain that. When you first go in the hospital, you're going to have a deductible of $1,408. If you are out of the hospital for 60 days and go back in the hospital, you are going to have another deductible. But let's say you were admitted in January and turned around in February, you went right back in. Well, you weren't out of the hospital a whole 60 days, so you don't have to pay that again. So just remember, it's each benefit period, which is separated by a 60-day out of the hospital. When you're in the hospital, the first through the 60 days, there's a zero. There is no copay for that. Now, these other ones where they list like 61 to 90 and 91 and plus, most people are not in the hospital that long anymore. But if they're going in and out, and maybe it's affected, but usually most people are not in the hospital that long. But there are copays if you are. Skilled nursing copay, I'm sure many of you have had friends or whatever that went to a facility for rehabilitation. The first to the 20th day, zero. Medicare pays all of that, okay? Now, if you're still there on the 21st day, then there is a copay of $176 per day. If you're in there past 101 days and you're still skilled, which is highly unlikely, there is no coverage, okay? And remember, this does require a 3-day hospital stay, and it's not in the emergency room observation. It's a 3-day full hospital stay before this benefit is available. Now, all these copays, we're going to explain to you then how you can get other coverage that will help you with your copays. The Part B is right now it's $144.60 per month. It comes out of your Social Security check. Late enrollees, if people wait and don't apply when they're supposed to apply, they can actually get a penalty. And the penalty after time does lead up quite a bit. Now, there is an annual deductible under Part B. That annual deductible right now is $198. Now, one thing to keep in mind, Medicare was never intended to pay all of your health care bills or your expenses and such. So keep that in mind that they're not going to pay 100% in most instances. And Medicare typically only pays 80% of the approved charge. So there's usually always going to be a 20% you're responsible for. So that kind of explains the deductibles at this point. I will tell you one thing. We are very fortunate in the state of Ohio. We are one of the few states that when you look at the difference between 80% and what is approved and the actual charges, the actual charge between that and what's approved is written off in the state of Ohio. So we're very blessed to have that. Okay, now I'm going to stop for now, and I'm going to go ahead and turn this next portion over to my coworker, Samantha.
Hi, my name is Samantha Fitz. I am Linda Havens' coworker, also known as Sam. I will be doing the next portion of our seminar today. So picking up where Linda left off, I'm going to talk about your Medicare options. So when going on Medicare, you have two options. You have option 1, which is going with original Medicare, your Part A and your Part B, a supplement insurance, which could be through a group health insurance, a MedSup, or also Medicaid, and your prescription coverage. You will have 3 different premiums for all of those choices. Or you can go with option 2, which is the Medicare Advantage Plan, also known as your HMO or your PPO plans. And this is where Part C comes into play. This contains your Part A hospitalization, your Part B medical, and your Part D prescription plan. This is all in one, and it also offers some extra perks and benefits in these plans as well. For individuals under the age of 65 and on disability that are new to Medicare, you can only, unfortunately, sign up for the Medicare Advantage plans. You don't get the option to sign up for the supplement plans. But when you turn 65, it's like you're reborn and you get to choose between the two options. You just basically start over at your 65th birthday. Understand that when you are choosing between the options with Medicare, your initial choice is very important because some options cannot be changed in the future. So I'm going to go into more depth on each option. Your option one is, again, the supplemental insurance. This is your original Medicare A and B, and then the supplement insurance. So you have three choices you can choose from. Your group health insurance, so from a former employer or a union, this is often known as your retirement insurance, and some retirement plans will continue with you, but you have to have Medicare. Or you could go with Medicaid. So Medicaid is also known as the qualified Medicare beneficiary. This can act as your supplement plan, but oftentimes a lot of people will actually pick up a plan, like an Advantage plan, but you don't have to do that. This plan is strictly for people who have limited income and resources. So there is income guidelines for this option. Or you could go with the private insurance companies that coordinate with the original Medicare, which is the supplement insurance. This is also known as the Medigap or MedSup. So Medicare supplement insurances, they're standardized by letters A through M. Unfortunately, for anyone that is new to Medicare starting in the year 2020, they took away the option C and F. So C and F can no longer be purchased if you're new to Medicare. But if you have C and F previously, you can be grandfathered in and carry that over. But just know that C and F are no longer options for anyone new to Medicare. The supplement insurances are also, they offer high deductible plans with lower premiums. So normally your supplement insurances, they do range a higher premium for the supplements, but there are those plans that have the high deductibles and low premiums. The good thing about the supplements is that they're accepted anywhere in the United States that Medicare is accepted. So because Medicare is your primary insurance, your supplement insurance has to be accepted anywhere that Medicare is accepted. You have little to no out-of-pocket costs other than your monthly premium, so you don't have any copays when you go visit the doctor. You are guaranteed issue, but only at initial enrollment. Your premiums also increase, though, every 5 years if there is an across-the-board premium increase, regardless of one's age. Also new in 2020, unfortunately, no insurance plan will pay your Part B deductible of $198. So along with the option one comes your Medicare Part D, which is your prescription coverage. So Medicare's prescription drug coverage is offered by private companies that contract with Medicare. This is available two ways. You can get a standalone prescription drug plan, or you can get it through your Medicare Advantage Plan, which is your HMO or your PPO. Your initial enrollment is the same as Part B. Medicare enrollees are required to have Part D unless you have credible coverage through employer or your spouse's employer's insurance, or you are receiving veterans assistance. So next is going to be talking about the premiums and the deductibles. Your average monthly premium for your drug plans are around $30. Your average annual deductible is $435. You will have copays, but those are going to be based on the formulary of your drug plan, which I will explain a little bit more in a minute. The coverage gap. So a lot of you may know the coverage gap also as the donut hole. Unfortunately, they said they were going to go away with the donut hole, but really they just renamed it. So what the donut hole or the coverage gap is when you have paid $4,020 into your prescriptions. So when you're between $4,020 and $6,350, you are in the coverage gap. This means that you get a 75% discount on all medications while you're in the coverage gap, meaning you pay the remaining 25% of that. Once you have exceeded that $6,350 for drug costs, you will go into catastrophic coverage. So again, that begins when you've spent $6,350. During that time, your drugs, your generic medications will become $3.60 and your brand name medications to around $8.95. So all drug plans have different cost structures and formularies, which are also known as tiers. Your drug comparisons are encouraged before enrolling in plans because not all prescriptions are covered the same on all plans. So for example, one drug may be categorized as a tier 2 on one, but on another it may be categorized as a tier 4. The difference between the tiers is the price of the drug. So the higher the tier, the more expensive the drug is going to be. The lower the tier, the more generic and cheaper they are. Tiers can change annually. So we also encourage doing an annual checkup in the fall, which is during open enrollment. So for example, if you get your prescription filled at Kroger and they have an agreement with the pharmaceutical company, the prescription may be cheaper due to a negotiated price between the pharmacy and the pharmaceutical company for 1 year, but then the next year it may increase significantly. So that is always something good to do each year to check your drug prices. Plans also have what are called preferred pharmacies. So again, drug plans may have an agreement with a pharmacy that wants you to use specific pharmacies when filling your prescriptions. If you are a late enrollee for the Part D, you may have to pay a late penalty fee of 1%. This is also for as long as you carry your Part D coverage. The penalty is calculated by multiplying 1% of the national premium average, which is $32.74 for the year of 2020, times the number of full uncovered months that you were eligible but did not have Part D. This final amount is going to be rounded to the nearest 10 cent and added to your monthly premium. You will pay the penalty for as long as you have Part D. Again, the national premium average may increase, so the penalty amount may also increase each year. It just depends. There are other options to assist with prescription costs, such as the GoodRx app. Many of you may know it. I myself use it because it is a very good resource to be aware of. There is the Extra Help Program through Social Security, also known as the LIS, Script Assist, and oftentimes you may also even be able to go through the manufacturers of the actual prescription, and they may offer the medication for free. So your Medicare Advantage and your Part D annual review, you can change your Part D only during your open enrollment period. So that time is October 15th through December 7th of every year. At that time, you can go do a checkup. You can look into what insurance plans you have to see if prices are going to change. Insurance companies should notify you if anything is going to change within the next year. So keep that in mind when you are receiving mail, and typically people will just throw those things away. But you do want to read and look into that because your drugs may significantly increase in price. So if you do decide to do the checkup and during open enrollment change your insurance, your coverage will actually begin the following year, beginning January 1st. So this just allows you, again, to change your Part D prescription plan coverage and your Medicare Advantage plan coverage, which is the HMO and the PPO. It's important to review those annually. We offer that service at our agency, so if you just want to call in, we will help you with that. Some certain life events that trigger other special enrollment periods for coverage could be if you move out of network area your current plan serves. So if you decide that, your children live in California and you live here in Newark, but you want to be closer to your grandkids, that will be a special enrollment period for you where you can change your plan without being penalized. If you enter, leave, or live in a nursing home, your plan changes and no longer serves your area, you are approved or lose extra help benefits through Social Security, and or you lose Medicaid coverage. So option 2, also known as your Advantage Plan, Part C, or your HMO and your PPO. This is available only if you are enrolled in Medicare Part A and B. You have to be enrolled in Medicare Part A and B in order to get this option, and also live within the plan's network area. So when choosing a plan, you can't just choose any Advantage plan. You want to make sure that it is actually being sold in the area of your residence. So this is an alternative to original Medicare. This is offered by private companies to replace. So your Advantage plans act as a replacement to original Medicare. Your plan types consist of your HMO, which is your health maintenance organization. This, you have to stay in network. If you go out of network and it's not covered, then you have to pay full out-of-pocket costs for whatever service you was provided. Or your PPO, which is a preferred provider organization. This one allows you to go out of network, but your plan still has to approve it, but it does give you a little bit more leeway in if there's an emergency or you're out of the county to get services and something happens. The majority of all plans for the Advantage plan option 2 include Part D prescriptions within it, which is your drug coverage. There are some plans that don't offer drug coverage. So if you get your drug coverage through the VA, then you can choose an Advantage plan that does not have prescription coverage because you have it. It includes extra perks such as limited vision, dental, hearing aid, over-the-counter monies, adult daycare, transportation, fitness memberships, also known as the Silver Sneakers. Enrollees are responsible to still pay your Part B monthly premium, but many of the Advantage plans offer a 0 monthly premium. So you may pay the $144.60 for your Part B, but if you have an Advantage plan, you may pay nothing a month to have that coverage. There is what is called a 12-month trial period. So you may have a guaranteed right to buy a Medicare supplement policy in either circumstances shown on the screen. One being you enroll in a Medicare Advantage plan when you are first eligible for Medicare at the age of 65, but within the 12 months you decide to replace the Medicare Advantage plan with a Medicare supplement plan. Or you drop a Medicare supplement plan and join a Medicare Advantage plan for the first time, but within those first 12 months, you decide to replace the Medicare Advantage plan with a Medicare supplement plan. I'll go more into going in between choices and going in between those plans a little bit further, but you do have this option of that free look or that trial period. So by law, when you purchase a Medicare supplement plan, you have a 30-day free look or trial period. If you change your mind, you can cancel the policy and get a refund. When you switch from one plan to another plan, be careful. Do not cancel your first policy until your free look period for the second policy is over. So moving between options, the first one I'll talk about is getting a supplement to a Medicare Advantage plan. So if you choose a supplement plan at the age of 65 and you're not satisfied, you age to 70 and you decide that you want to go to an Advantage plan, you are going to be guaranteed issue enrollment, or you're going to be guaranteed issue anytime enrollment is open. So October 15th through December 7th or January through March, which is the general enrollment period, you will be able to switch to a Medicare Advantage plan. With a supplement to a supplement, you're not going to be guaranteed issue at any time. There is no specific time frame that you have to change your plan into, but plans will be able to underwrite you, meaning they can ask you health questions. Based on your health question answers, they can either deny you the coverage and say, no, you're going to cost us too much money, we're not going to cover you. Or they will say, sure, we'll cover you, but your premium is going to be significantly higher than another person of the same age based on your health conditions. If you want to change from a Medicare Advantage plan to another Medicare Advantage plan, you're guaranteed issue anytime open enrollment is open, which is October 15th again through December 7th, or your general enrollment period, which is January to March. If you decide at the age of 65 to go with a Medicare Advantage plan, but it doesn't work out for you down the road because let's say your health issues increase significantly, you're not as healthy as you were when you were 65, so it's costing you more money by paying those co-pays, so you want to switch to a supplement plan, you're not guaranteed to issue. This is the hardest options to go in between because Medicare knows what you're doing. They know that you're trying to save money. So if you try to go from an Advantage plan to a supplement plan, they're going to ask you health questions. And based on those health questions, they're going to say, yeah, we'll accept you, but your premium's going to be a lot higher. Or they're going to say, no way, you're going to cost us way too much money. So this is a summary of what your options are. This just gives you a basic overlook of each option with Medicare. So comparing these options, you've got cost here, and with your Medicare supplement, looking at it, you're going to pay your Part B premium, You're going to pay a higher plan premium, but you have little to no out-of-pocket costs. With your Advantage plan, you're going to pay your Part B premium. You're going to pay lower or no plan premium, but you will have out-of-pocket costs, copays every time you go and get a service. Your provider choice. For the supplement, you have no network restrictions on physicians, hospitals, etc. So if you retire and you plan on traveling, this may be an option you consider because, again, you have no network restrictions. Supplements are accepted anywhere Medicare is accepted in the United States. And you actually may have foreign travel emergency coverage. You would just have to look at the plan that you purchase. For the Medicare Advantage plan, you will have a provider network. Cost will be higher if you're out of network. Your responsibility is to make sure that the provider is in network, including hospitals. So if you choose to go with an Advantage plan, it's your responsibility to call your doctors and your physicians and make sure they are in network. Otherwise, you will pay fully out of pocket for any services. And then also, you will want to check with your Advantage plan to see if they do have foreign travel restrictions. Some considerations. So for the supplement plan, some considerations to have is, again, it's accepted throughout the United States anywhere Medicare is accepted. Oftentimes, people who can afford a higher monthly premium will go with a supplement plan, but just remember that premiums increase every 5 years. This is a big one, that there is no coverage for vision, dental, or hearing. But oftentimes, the supplement plan you choose may have those extra packages that you can bundle with your supplement, but remember, you're going to have a premium for those. And then they also actually might offer a discount for household couples. So if you and your wife or your wife and your husband, decide that you want to go with the same supplement option, you can actually get a household discount with going with the same company. Considerations to have for the Advantage plans. You have to be willing to use a network of providers. They may have added benefits. So the vision, dental, the hearing, fitness, it may be included, and that may be something that's important to you. And then your choice of a Medicare Advantage plan is usually determined by your medication coverage. So if you're going to choose a Medicare Advantage plan, you want to run your prescriptions and pick the plan that is lower cost for your prescription coverage. And then the drug coverage included. So remember, with your supplement plan, it is not included. You do have to purchase a separate Part D, which you will have another premium for that. And then the Advantage plan, your drugs are included in most of those plans, but you can, again, get some plans that don't have that coverage if you already have that coverage. I am going to turn it back over to Linda, and she will explain the rest of the PowerPoint.
Okay, we'd like to finish up our program today about talking about some programs that are available for those that have lower incomes. There are some very nice programs out there. So we're going to discuss these a little bit then. The first one is the Extra Help Program. This is an absolute wonderful program. Now, what it does, now keep in mind, your income has to fall within the guidelines, and then also your resources have to fall within the guidelines, but they're pretty generous for the Extra Help Program. What it does is, if you're eligible, it actually, you usually will have no premium at all for your prescription. So if the prescription drug coverage you're getting was costing you, I don't know, $30, $40 a month or something like that, usually the Extra Help Program will pick up that. Typically they pick up to about $30 of the premium a month. There is either a reduced or there's no deductible. Samantha talked about the $438 deductible that most of the prescription plans do have now. Usually they will pick that deductible up also. Now, here's what's wonderful about it. You don't have to wait to get into the catastrophic coverage section. Automatically, if you have a generic medication, you will pay no more than, it starts at $0, or no more than $3.60 for these generic medications. If you're taking a name brand medication, you will pay no more than $8.95 for your prescriptions. And some of these are actually 90 days sometimes too, depending on how it's ordered. But like I said, this is absolutely wonderful because it really reduces the cost of your prescription drugs. Okay, the savings programs. This is a whole different type program. And this one goes to the Department of Job and Family Services. Once again, you do have to be financially eligible to receive these. But the programs offer a variety. There's a variety of them. They will pay that Part B deductible, or premium, I'm sorry. The premium right now is $144.60, so it would actually pay that each month. So for someone who's getting a real low income of only $700, and then they take out the Part B, if they can get that paid for, that gives them $144.60 more a month. It also pays all the deductibles and co-insurance that Medicare does not pay, okay? So once Medicare makes their payment, if you're eligible for some of these programs, it could pick up all the deductibles and co-pays. And then under your prescription, like I said before, it also helps to pay for the prescription coverage, the monthly premium. And then lastly, if you're someone that has to pay the Part A premium, which I said there's very few people that do have to pay that premium, but if you do, it can also help then pick up that premium, which can be quite expensive over time. Okay, we want to talk a little bit about agent sales. And I will give you an example. I went to see a woman the other day, and when I got to talking to her about her coverage, she had 3 different insurance cards. Humana had sold her a plan, then Anthem had sold her a plan, and then she went back and another Humana person sold her a plan. So you've got to be careful, especially in the fall. The TV, you will be inundated on the TV with all the new plans, how they're better than the other plans. And then also, you will get a lot of stuff in the mail. And that's how we can help you here at the Aging Program to make sure you're picking the plan that's best for you, not the one that an agent thinks you should have, okay? So we want to make sure, watch that, please, if you can. Don't just purchase the first thing that comes out. They cannot give you cash gifts or gifts. A lot of them will use the high pressure thing. Well, you got to get it now. This is, you know, they'll tell you anything to sell it. Or they misrepresent a plan. For example, I had a lady who bought HMO because of the fact that she could get nutrition counseling, and she really needed it on a regular basis. But once she bought the plan, and then I looked into it, come to find out she had to have a computer. She didn't have a computer. So she couldn't get that benefit at all. And if they represent themselves as Medicare, that right there is an immediate shutoff because they are not Medicare. Medicare does not come around to your house. Now, if you feel you've been victimized, get as much information as you possibly can about the agent. And then also make sure you get all their information and everything so that you can report them to the Ohio Department of Insurance. And also during the pandemic, make sure that agent that's coming to your house, make sure that they have a mask on, okay? Okay, we do have additional resources that you can go to in order to get more information. Now, Samantha and I are trained OSHIP volunteers. We are certified and we're trained by the Ohio Department of Insurance. But you are more than welcome to call the Ohio Department of Insurance at this toll-free number so that you can get maybe a quick question answered or whatever. Also, if you're computer savvy, you can go to Medicare.gov On there, you're actually able to put in your information, and you can determine whether or not what types of insurance plans would be appropriate or cost effective for you. So this is a wonderful site also. Another thing too is the fact I highly recommend that you receive our newsletter each month through the Licking County Aging Program. We have lots of services, programs. It's a very, very informative newsletter. So you can call into the aging program and request to be put on the newsletter list, and they can mail it to you or email it to you. So I highly recommend that. Also, one of the things we wanted to just mention is that when we were talking about agents and stuff coming to your homes and everything, a lot of you may have seen right now there's a scam going on that be very, very careful of. And that scam is that they will send you a free mask for your Medicare number. Do not give your Medicare or Social Security number over the phone. That is a total scam. It's a way for them to get your Medicare number, and then they can use it for fake billing. So we just want to remind you of that also. Now, if you would like copies of the slides, they're actually on the website also. You can go to Home Services, go under Social Services, and there you will find a copy of all of our slides that we have shown today. If you would like copies of brochures, we have the ones on the low-income programs that are available. And then we also have a great guide called Medicare 101, which answers a lot of your questions, and it includes the chart for the supplement insurances so that you can look the letter of the insurance up and you can see what benefits it does provide. So that is also a very, very helpful tool. If you would like a personal conversation or assistance from Samantha, I've listed her phone number here, which is the aging program, extension 243, because we realize while we're giving you kind of a synopsis of Medicare, everybody's individual. The husband and wife could have totally different outcomes of what insurance or coverage they need. So we encourage you, especially when you're making this first choice, this very important choice, we want to make sure that you pick the plan that is appropriate for you and going to meet your needs. And like I said, everyone's individual. Just because your neighbor has a certain plan doesn't mean that plan is good for you. And that's what happens. A lot of times people buy a plan because their family has it or their neighbor, but it's not specific for you. So please, I encourage you to call Samantha. She can answer your questions on the phone, or she can schedule a phone appointment with you so that she can go over in more detail about the plans and what's best for you. We hope that you found this program informative. We encourage you to call us, and hopefully when the pandemic is all over, we'll be able to return to our programs here at the Heritage Hall. So until then, we'll try to keep you updated and make sure and get our newsletter, because there will be lots of information in there to keep you updated on what's going on with Medicare. Thank you.